Welcome to the inaugural episode of UB Medicine Podcast. My name is Allison Brashear, and I am the Dean of the Jacobs School of Medicine and Biomedical Sciences and Vice President for Health Sciences at the University at Buffalo. This series explores how our faculty, learners, and partners are driving innovation, advancing education, leading through change to transform the health across Western New York. In this first episode, we are focusing on the Jacobs School's strategic vision and our evolving role in addressing the nation's most pressing health challenges. I'm joined today by two remarkable colleagues, Dr. Tim Murphy, SUNY Distinguished Professor and Senior Associate Dean for Clinical and Translational Research, and as he prepares to retire after serving the Jacobs School for an extraordinary 44 years, we reflect on his legacy of leadership, research, and community impact. Also joining me will be Heather Gardner. Dr. Heather Gardner is the newly appointed Carl V. Granger Endowed Chair in Health Equity and the Director of the Community Health Equity Research Institute. A UB alumna and nationally recognized scholar in health communication and disparities research, Dr. Gardner brings a bold vision for community-engaged research and innovation. Together, we'll explore how the Jacobs School is transforming health in Western New York through strategic priorities, collaborative partnerships, and a deep commitment to serving our communities. I just wanted to start by talking about why this podcast is so important. Here at UB Medicine, we want to really share what's going on at the Jacobs School of Medicine and at the University of Buffalo and how we're transforming the health of Western New York. So at UB, we have strength in research, education, and the clinical environment, and we tie those all together. Our research strength is a sustained and increasing growth in NIH funding, as well as a focus on clinical trials. Our clinical excellence really resides in the fact that we have 631 faculty who are committed to improving the health of Western New York. That includes a variety of primary care physicians and specialty physicians. And we want to make sure that our patients get the access to care that they need, where they need it, when they need it. UB has strength in artificial intelligence, and recently UB was named the home of Empire AI, a $500 million initiative led by Governor Hochul. The launch of Empire AI, the beta version, has started where we have a supercomputer that is 11 times more powerful than its predecessor. I heard it said best that Empire AI is kind of like having the Hubble telescope in your backyard. You get to work on the most powerful machine in the world at your fingertips. UB now hosts one of the most advanced academic AI computing centers across the world, just like the Hubble telescope. Seed funding for Empire AI and the AI initiatives at Health have included predicting protein structures, identifying protective factors in child development, streamlining clinical workflows, and creating a surgical video for training so that everyone is on the same page. We've also been working with our hospital partners in a transformation of our electronic health record. And together, UB, MD, UB, ECMC, and Kaleida Health are implementing EPIC, and that will transform the healthcare in our region. We've been growing the number of masters, PhDs, and physicians, and we put a renewed focus on making sure that we are training the next generation of physicians that we want to stay here in Western New York. And that includes a renewed focus on making sure that we have primary care physicians who are going to stay here and work in Western New York. Together, the Jacobs School of Medicine and UB are taking the clinical, research, and education portfolios and knitting them all together to be able to make a fabric that really ensures that everyone in Western New York is healthy. That's good for our community, and that's good for our businesses. So we're investing in innovation. We're expanding our research enterprise. We're modernizing our medical education. And all of that is to have a deep, deep impact in our community. And you wrap that all up with our strength in AI, and we're going to make a home run. A key pillar of our strategic plan is research innovation. Please join me in welcoming Dr. Tim Murphy, who has been instrumental in shaping our research enterprise for over 4 decades. Dr. Murphy, congratulations on a wonderful career, and thank you for your many decades of service to our school, our university, and our community. Reflecting on your 44 years at the Jacobs School, what are you most proud of?
Thank you, Dr. Bashir, and thanks for the opportunity to talk with you today. Well, first, it's been a privilege for me to work at UB for 44 years. It's my only real job. So I'm gonna give you 2 things because my career really has 2 segments. The first was I came as a very junior infectious diseases physician scientist, and I spent many years in what I call my infectious disease bubble. I took care of patients, I did my research, and trained lots of graduate students and medical students and so forth in my laboratory. And, one of my goals was to develop a vaccine to prevent infections in COPD, and similar vaccines would prevent otitis media, that's ear infections. That didn't quite happen, but the work really advanced the field to the point where we are closer to those goals at this point. And then the other thing is the students that trained in my lab and the medical students that rotated through my lab, it is really rewarding to see what they've done, and where their careers are going. Then around 2009, 2010 is when I kind of came out of my infectious disease world and went into the clinical and translational science world. I realized that, all that time I was doing translational research, but I wasn't really called that then. And this was a very growing area nationally and so forth. And it was a huge opportunity at UB because we have such great researchers, and the whole concept of translational research is to reduce the time that basic science observations get translated into healthcare interventions. So that's what I've really been spending my time on for the last 15 years or so. The initial plan was to win a clinical and translational science award, the large grants. It was supposed to take 1 year. It took 5 years, but that's part of the journey. And now we have this wonderful Clinical and Translational Science Institute that is helping our researchers really advance healthcare through translational research and clinical research.
So the Clinical Translational Science Institute is a real game changer. And as we've been talking recently, it really brought UB into the world of NIH funding. Can you share a little bit more about how that will set us up to transform the health of Western New York?
Yes. So the Clinical Translational Science Award is a large grant, but the other thing that happens is it brings you in to a national consortium of 60 or 65 of the leading academic health centers and medical schools in the country. And this creates almost automatic and very facilitated collaborations and partnerships and so forth. So we can share the things that we develop here, and we can learn from the other institutions. For example, one of the game changers coming up in Buffalo, in progress right now, is the One Epic project. The idea that we will, in our entire region, have a single electronic health record. This will transform healthcare, and it will transform research. It opens up enormous research opportunities that will directly benefit the people in our community.
Yes, I agree. It's as you've said many times, it's a game changer. you have really developed deep relationships with the community. I remember that. I learned that when we first met. Can you share a little bit about how you hope that will continue to deepen and solidify the relationship with the community, and how maybe all the rest of us can carry on that legacy?
Thank you. When we established the Clinical and Translational Science Institute in 2015, we developed the vision to advance and accelerate research to improve the health of our community and the nation. And so much of the work that we do in the CTSI, all of it, is really geared towards improving health in our community. And in order to do that, we need to work with the community. The old way of researchers doing it, and this is really very outdated, is somebody would go get a big grant and they go to the community and say, hey, I got this great idea, this great grant. Will you give me this data, and can we enroll in these studies and so forth? And then when the grant is over, they disappear. So the way to do it now, and the way our researchers are learning to do it, is to work with the community in the planning of the grants, in driving the research agenda. What's going to help our community? We need to hear from them. They're going to help us with our research and help us increase the impact of our research. So I think it's learning how to change how we as researchers interact with our community, because many of us were trained in very different ways. And so that I think is critical in terms of the way research can change how we interact with our community and improve the entire relationship between University at Buffalo and our community. Those relationships between universities and communities have long been difficult relationships. And I think in Buffalo, more and more of our researchers are taking this new approach, this more informed approach to work with our community. And that's what's going to actually really continue to improve the relationship and also continue to increase the impact of the research that we can do at UB.
If you were going to give a few words, a sentence to the next generation that's going to fill your very, very big shoes, what would those be?
So I'd say two things. You keep asking me one, and I say two. So I think about the technology that existed 44 years ago when I came to UB. We hadn't even sequenced one bacterium. And look at what AI is doing. So I think number one is we need to remain open to new technology and understand the power of new technology, and particularly with AI, understand the limitations and the risks. And the second thing is what I just talked about. Remain open to ideas from community members. Lived experience can be just as important as all the degrees that people have. And so I think valuing that kind of lived experience and that kind of knowledge is critical.
Dr. Murphy, we are so grateful for everything you've done for UB, everything you've done for the community. And I hope you'll come back and visit us sometime. And we are just so honored that you took the time to speak with us today.
It's been a privilege. Thank you.
I'm joined now by Heather Gardner. Dr. Gardner, welcome back to UB. We're thrilled that you've come here to tackle the pressing issue of health equity. So we're going to start off and talk about what inspired you to return to Buffalo and to take on this leadership role at such a pivotal time.
Thank you. And thank you for the invitation and the warm welcome. I have to say that's something that has stood out in my 3 months being here, is everyone in Western New York has really embraced my return. I decided to come back for a number of reasons. First and really foremost, I was and continue to be very impressed with all of the great work that has been going on in this space in Buffalo for the last 10 plus years. So among the other many accomplishments that have been made, efforts with Dr. Murphy, Cherry, the Buffalo Center for Health Equity, and others have resulted in a strong, sustained community, academic, government partnership that has made health equity a priority in this region and has laid a solid foundation for future work to improve parity in health and healthcare outcomes in Western New York. I was also really thrilled to learn of the university's commitment to health equity, evidenced in the strategic goals of promoting a university-wide culture of equity and community engagement, in initiatives like the Lighthouse Clinic and the Brainy Bulls program, and through the university-level support for the Community Health Equity Research Institute. On a more personal note, I was born and raised in New York, so it's really a homecoming for me.
Well, we're so glad that you came back home, and we're so thrilled to have you here at UB. You have a deep expertise in communication, particularly around health and disparities, and you bring those strengths that are going to help shape the future of the Community Health Research Institute. How do you see communication being really important in the Institute?
I think that is the critical piece of what we do in the Institute. I've been conducting community engaged health equity research for most of my career. And this experience that I bring with me here will support the maintenance and further development of these partnerships that I just spoke to, and also the creation of new ones. In addition, my background and training will help inform culturally and linguistically appropriate messaging. And one of the things I really particularly enjoy is mentoring the next generation of health equity scholars. And I really look forward to imparting some of my experience on those folks as they come through. In addition, I do bring a unique, maybe not so unique experience or perspective of being from a historically marginalized community. I'm a woman of color from a blue-collar, low-income family, and I have witnessed and felt the effects of inequity. So it really has strengthened my commitment to seeing Western New York transformed into a place where everyone really can live the happiest, healthiest life.
Well, very well said. I think all of us know that there are health challenges here in Buffalo. And one of the goals of the Jacobs School of Medicine and of the University of Buffalo is to transform the health of Western New York and to be a role model for the country. Could you just share a little bit of how you see the UB Health Equity Research Institute addressing some of these on a more practical level? For example, we have the Lighthouse Clinic, but we have a variety of other things that we're doing.
I see Cherry's role as playing a really critical part in addressing these inequities by promoting and supporting multidisciplinary, community-engaged health equity research that addresses community-identified problems and needs. Over the last 5 years, under Dr. Murphy's leadership, Cherry's nurtured community partnerships and secured external funding to support the Igniting Hope conferences, including a center grant from the National Institute of Minority Health Disparities to fund pilot studies and community projects focused on increasing equity on Buffalo's East Side. Over the next 5 years, we'll build on this work with a vision of making UB a nationally recognized leader in health equity research and in training, including training and working with communities in a way that fosters authentic partnerships and builds community trust. And I also see Cherry's role as being a strong advocate in policy changes that will help advance this work and really truly transform health in the area.
You mentioned community trust, and I think trust is critically important in building relationships. So what do you think makes Buffalo unique? Because you have a lens of growing up in the area, coming back, and of course, all of the ideas that we have about, really working together with our community.
And that is, in fact, what I think does make it most unique. It really centers community voices, tackles structural and systemic challenges head on, integrates social determinants into health strategies, and builds future leadership pipelines. This combination positions UB and Buffalo as a national model for how to do equity work authentically and sustainably.
Very well said. Thank you so much, Dr. Gardner. Dr. Murphy and Dr. Gardner, your work truly embodies our mission to transform healthcare in Western New York through the clinical excellence and community partnerships, all tied up with research, of course. So as we wrap up, I'm going to ask you each one question. What's one key thought that you hope our listeners will have about the future of health in Western New York?
So I think the future of health in Western New York is improving. These are problems that have not been solved for hundreds of years, where we have folks in our community who don't have the same health outcomes as other folks in our community. There is a movement occurring right now that is partnering the community and the government and the university. Dr. Gardner referred to it, and we have this tremendous partnership, and I think we have a chance to actually really make a difference.
I believe that improving equity across the region takes a collective effort and is going to be based on those relationships that we talked about before, and a really authentic partnership between practitioners, policymakers, faith leaders, scholars, community members, and industry partners. And it will take us all to move the needle.
Thank you, Dr. Murphy and Dr. Gardner, for joining me today. Your work is vital to transforming the health in Western New York. And to our listeners, thank you for tuning in. We look forward to sharing more stories about impact, innovation, and leadership in the episodes ahead.